This video will be about diabetes. Specifically, the video will be about diabetes mellitus. Usually, when people talk about diabetes, they are referring to diabetes mellitus. Now, we're all busy, things to do, people to see, places to go. To make this happen, we need fuel. One of the best fuels is sugar. We obtain sugar from the foods that we eat. The food gets broken down in the digestive system into separate pieces. One of those pieces is a sugar molecule called glucose. The glucose gets transported all around our body within our arteries. Eventually, the glucose will enter a cell in our body to be used as fuel. But something's happening. Glucose cannot enter our cells. This results in diabetes mellitus, which translates to sweet pea, a throwback to when doctors had to taste their patient's urine to see if it tastes sweet in order to diagnose them with diabetes. Let's look into how glucose molecules enter our cells. Here's an imaginary cell, and here are glucose molecules, and here's a tube. Glucose molecules go through the tube and enter the cell. Now then, this tube is not always open to the outside. Usually, it's in the cell. It comes out when insulin tells it to. Two things can go wrong in this situation. First, insulin could never show up. Second, insulin can be present, but the tube doesn't come out. These are the two scenarios, and they explain the situation in type 1 and type 2 diabetes respectively. 10% of people have type 1, 90% have type 2. I will be discussing both diseases in more detail in other videos. So, what's the big deal with diabetes? Diabetes and diseases that can be caused by diabetes are in the top 10 causes of death starting at age 15. To help understand, I will tell a story. In 2007, Jennifer Strange, a 28-year-old woman, entered a water drinking contest to win a Nintendo Wii. Mrs. Strange consumed 2 gallons of water before she began experiencing a headache. Hours later, she had unfortunately passed away. The cause of death was brain swelling due to water intoxication. The point of this story is to relay the first thing they will teach you in Pharmacy 101. Anything becomes poisonous to the body if enough of it is added, including water. Back to where we were. We should realize that if the glucose is not in the cells, then the glucose is in our arteries. The glucose will eventually interact with the blood vessel's wall. The walls of the blood vessels respond by becoming thicker. When the artery walls become thicker, less blood is able to travel through them. Blood is needed to transport fuel and resources to all of our body's organs. This can eventually lead to different deadly diseases: heart attack, stroke, clotted limb arteries, eye diseases, and kidney diseases. Here are the fancy names in case you are interested. Sadly, there's more. Remember how I said insulin is needed to allow glucose to enter the cell? I lied. There's always exceptions. For example, neurons do not need insulin to allow glucose to enter. There's a problem with this. Managing glucose uses the cell's resources. Remember our story about too much water? If there is too much glucose, then the cell's resources will be used to manage it. This results in other chores going unattended, eventually resulting in cell death. This is known as diabetic neuropathy. I want to elaborate on this. People with diabetes are at risk of diabetic foot ulcers. This is due to the combination of the foot not receiving enough blood and the nerves in the feet dying. As painful as this may look, diabetics usually cannot feel it. This is because their nerves have died and their feet are numb. Next, we need to go back to the eyes. Let's look at eye anatomy. Inside the eye, we have a structure called the lens. Like neurons, the lens does not need insulin. As glucose enters, the lens ends up swelling and darkening. This is one of the causes of the disease known as cataracts. One last disease, urinary tract infections. How does this work? Do you remember what diabetes mellitus means in English? Sweet pea. As all the glucose is traveling in our blood throughout the body, some of the glucose gets filtered out by our kidneys and enters our urine. There's nothing germs love more than a wet, warm area with plenty of sugar to eat. For the sake of time, I will cover the causes of diabetes, the signs and symptoms, the labs and imaging, as well as the treatments in other videos. As always, thank you for watching.